what are your suggestions in terms of treating pathologies of the brain? Because so many drugs have trouble passing the blood-brain barrier, or they pass and they're quickly effluxed out. So what is your suggestion on that matter?
I'm not really an expert in that. The whole issue of drugs that target the central nervous system, as you can imagine, let's look at mental health as a universal target these days. There's an awful lot of work in that area. And what we are not good at yet is predicting in who a given drug is going to be successful. But more importantly, in who a drug that may be successful but is also going to have adverse event profiles. So I have been asked to work with companies on predictability of adverse event profiles. So this is companies elsewhere. Because of my experience, they started thinking, okay, you've got the skills in looking at data, can you help us with this mental health challenge? And I've done some of that.
Okay.
But in the end, the difficulty of that challenge, which is a diverse group with, if you want, an incredible diversity of biological differences, and now you're expecting a single drug, if you're testing a single drug, to go in and have that ability in all of those people. I think one of the mistakes that we've made is that we've not addressed early enough in this whole drug development process the idea of precision medicine. And that is, precision medicine could be looked at two ways. One is develop a drug with a precise control on a given patient, or pick the right patient for which it works. So recognize that we need to phenotype patients first and foremost.
Okay.
Find out what kind of person they are. I don't just genotype, because genotype's not enough.
Mm-hmm.
Genotype, phenotype, epigenetype, like you gotta do the whole package. You gotta know who they are, what they are, and hopefully you can pattern on the drug response to them and know that if you can find that kind of phenotype and that kind of genotype again, you have an increased likelihood for success, as opposed to grabbing 1,000 people and finding out that there's 8 phenotypes in there and there's only going to work in 25% of them, which is what happens now. We have this failure rate, which is extraordinary, with some benefits, but in some it doesn't work at all. So precision medicine is something that I think the mental health and central nervous system acting drugs face that more than anything else. The diversity is extraordinary.
So do you think that tailoring drugs to like subpopulations of people would be more effective?
Yes.
Yeah, so, but how do you think that would work in terms of scale up? Like, how would you find all these people in subpopulations, and where does the cost consideration comes in of phenotyping people? And you want, of course, enough of an audience to eventually sell your drug to.
Yeah. Well, the highest percentage of the healthcare dollar on a single field is in the treatment of hypertension.
Okay.
Right? So it's double the cost of mental health, right?
Yes.
Right now, because you have to go into a doctor's office, they're checking your blood pressure, and then you're modifying medications. How do you phenotype an individual, for starters? How do you create precision medicine? Well, in Canada, we're probably the best in the world at precision medicine of an individual to treat their hypertension. We're closing in on 65 to 70% controlled treatment of hypertension in Canada, which is really, really good.
That's remarkable.
It's quite good. How do they do that? Well, they have an algorithm which is based on trial and error. So it's not that we know how to take a person into the office and say, okay, let's check you out, let's take a skin swab, let's take a buccal swab, let's genotype you, phenotype you, you name it. No. They try drug 1, fails. Try drug 2, try drug 3, try drug 4. So they actually do the experiment. Which drugs do you respond to?
Okay.
So what they do then, once they do a very quantitative analysis of what you respond to, if it's not enough, they escalate doses, right? So they have both change of drug with a series of known drugs with known efficacy. If they don't work, they switch you to another drug. If they don't work as a single, they add a double. If they don't work as a double, they go to a triple. Right now, it's averaging 2.6 drugs per person.
Wow.
So guess what? We still don't know their phenotype. Their phenotype is they respond to the drugs.
Okay.
In Canada, 65% or more people respond to the drugs if they're given by escalating the number of drugs and the dose of the drugs up to a certain point. So there's an example of the entire field has had to address it with precision medicine to realize that that individual's phenotype, which is their blood pressure, is telling me I need to do more. So I have to increase the dose or increase number of drugs. Okay. So when we go to other areas, until adverse effects hit, because then you have to back off.
Right.
So with mental health, let's say with depression as an example, how do you manage depression? Again, do you pick the right dose? Well, a physician would pick the drug they're most familiar with and have had some good success with. They try it, and you hope there's adherence to the drug and that nothing else in the person's life has changed, and they try it for a number of weeks.
Right.
or longer, because everybody adapts, and the adaptive process can take multiple weeks to multiple months, and then you track that the best you can, and then if it doesn't work, you start with another drug. And the person's like, right? So the disappointment of that, because that impacts on life. Hypertension, they don't know they've got hypertension.
That's true.
Easy peasy. You can manage that, but with mental health, that's a very different picture. So they do trial and error, and they do based on precision medicine, but it's a hard outcome.
Shift gears, I'm going to ask you a different question. So what are your thoughts on recent advances in replicating organs using microfluidic chips, and where do you see them fitting into the drug development process?
Well, there's actually two ways. I thought you were initially asking me on regenerative medicine. The idea of, let's say, making a bladder or making a cardiac valve based on the person's own cells, and picking cells, stem cells, and repurposing them and putting a scaffold together. And so let's look at it that way. That's the advanced way. So if you think of doing testing, you can do the in vitro testing by creating, if you want the equivalent of an organ in vitro.
Mm-hmm.
I have a hard time with that for
Okay.
organ analysis, because the complexity of our organs, even our simplest organs, with the scaffolds involved and the functionalities involved with the blood vessels and the nerves and the cell types and the extracellular matrix, and
Yeah.
I have a hard time with that because I'm an in vivo guy. I don't believe that's good for screening,
Okay.
early stage screening, not for later stage. You need to know the phenotype in an in vivo environment, otherwise you don't have the same thing. That's a belief. That said, I also am quite excited by people who are able to create scaffolds and build organs. There has been some success in that, not a ton, but some success. And we're learning a ton by doing that. I mean, the idea that you can take somebody who's had, traumatic damage or born without, and you can potentially give them an organ or a tissue that they didn't have before, that's pretty cool. And then actually, what about an organ or tissue that has got specific targets in it that are designed in? Yeah, I like that. That's a cool concept. We're not there yet. We're obviously striving towards those kind of things, and but it's a cool area to work in.
How many years do you feel that till this sort of work where we could grow organs using a scaffold? How many years do you think until this takes off?
Really takes off?
Yeah.
Less than 10.
Less than 10? Okay.
That'd be my prediction, less than 10 though.
All right.
Yeah, it depends. We're gonna get small areas where it's jumping in and, there's things that we just don't know. I was having a chat with a student this morning who gave me, she had to do a comprehensive exam paper, and she happened to work on endometriosis lesions, which are chunks of endometriotic tissue that have transferred off into great lesions in other parts of the body.
Okay.
Guess what they do in the other parts of the body? They attract nerves and blood vessels.
Interesting.
I went, ding, ding, and I had a patent. I said, did you file on this one yet? And she goes, what? And I said, she wasn't even doing that as a project, but that's immediately what my mind said.
Okay.
There are some properties that are produced by that tissue which are extraordinarily growth promoting.
Yeah.
The propensity to attract nerves and blood vessels, excuse me. So how do you do that? So transplant hearts, transplant kidneys, wow.
Yeah,
Yeah.
that has immense potential.
Yeah.
So Dr. Adams, on a final note, what would be your advice for someone who has an idea but is looking to build that drug into something that they could take to market?
This is a hard one for people with really, really good ideas. One is it's very hard to do it alone. Very hard.
Okay.
It's also not as much fun to do it alone. So if you're going to share it, be willing to share equally.
Okay.
Because if you fight over percentage points, it's a mistake. We went into our company and said, whether I was the bigger player on the intellectual property or not, let's make our role in the company equal. So students equal to me in a company, and why? Because that's the incentive to push forward. If you don't have that incentive to push forward, you lose everything. You need everybody on the same playing field, and obviously you have to trust the people around you.
Definitely.
Right? So be willing to share. Because by the way, 100% of nothing is nothing, but a percentage of something is still something. And if you don't realize that, you can work 10 years and have 100% of nothing. And that's a lot of work to get you nowhere. And it may be that your idea is great and it's before its time, because I think a lot of our ideas were just before their time. But at the end, if it doesn't work, it's because it didn't get there.
Okay.
And if you fight for it yourself and keep it closed, I don't see it working. Those are the two, you have to have the patience and you have to have a lot of energy. Like you have to drive yourself. You can imagine I was doing 2 jobs, right?
Yeah.
So I was a company founder, company director, and full-time job.
Wow.
Taught the whole time, didn't take leave, just went like a bat out of hell. Yeah.
Well, I guess you had both the patience and the energy.
I guess, or maybe I was just silly. I don't know. Yeah.
So in today's modern day competitive world, science has become a lot of a business once it gets translated and upscaled. Would you recommend science students to, say, pursue an MBA or get other entrepreneur experience in order to succeed in today's modern day science world?
An MBA can help. Experience is pretty important.
Hmm.
You gotta have a business sense, right? You gotta know, you gotta know value. You also have to know when someone else is not perceiving your value. So if an MBA program can teach you how to listen to other people, great. If you're still the same person at the end of that and you're not any better, then it didn't do the job.
Okay.
So you have to have certain attributes to really know the job. I mean, when I do contract work now with companies, which is sometimes fun because it's a real collaboration, it still is about me listening to them. What are their needs? I know what my needs are, though I'm clear in my head. Am I willing to do this, understanding that I want to fulfill my needs, but also their needs? If not, why am I working with them?
Okay.
I will only do it if I see fun in it and exciting gaps in knowledge to be resolved. Otherwise, why am I doing it? Am I just doing it for the contract money? That's not me. I want to do it for the fun of it, the drive, the real exciting stuff.
All right, thank you, Dr. Adams. We've learned a lot today, and we hope that you've enjoyed this segment of our interview series.
No, thanks for interviewing me. It was great.